welcome to another edition of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Vicki Hedley. Vicki Hedley is a certified professional midwife through the North American Registry of Midwives and a certified midwife through the American Midwifery Certification Board. She graduated from National College of Midwifery in Taos, New Mexico, and is licensed to practice midwifery in New Jersey and New York. She has 18 years of experience, having attended over 500 births in hospitals, birth centers, and homes. She started her midwifery journey as a birth and postpartum doula, doula trainer, and childbirth educator. She is the owner of Seventh Moon Homebirth Midwifery Services with locations in Montvale and Hoboken, New Jersey. Welcome, Vicki.
Thanks, Laura. Nice
so I'm excited to have you here and to share with our audience about home birth. So we're going to focus on that topic today because you have focused your practice exclusively on home birth.
Yes, that's true.
So please tell us.
Sorry, go ahead.
Go ahead. Tell us about your path of becoming a home birth midwife.
Right. So I was a doula and a doula trainer and a childbirth educator starting in 1996 when I kind of accidentally ended up at the birth of a friend's daughter. And that started me on my path toward doula work as a birth doula first. And then my second birth doula client was my first postpartum doula client. So it just kind of moved on from there. I had a doula partner back then, Susan Esserman, who was a wonderful, still is, wonderful therapist and works with new moms and families. And so we had a very large doula practice, and we trained doulas for many years. And as I spent a lot of time in hospitals, mostly in hospitals for births, I was, experiencing the difficulties that women were having at hospital births and decided that I wanted to offer a different kind of care than they were receiving in their hospital experiences. And so I decided to become a home birth midwife and became a home birth midwife in 2008. So I've been attending births since then as a home birth midwife. It's awesome.
Yeah. I mean, I know it's like your passion.
Yeah, I love it. We work exclusively. I'm very, very fortunate to have a wonderful network of people who help me when we need it for backup situations, and we are able to, easily transition into the hospital when need be. So there's, not a whole lot of problems there, and it works out great. Home is a place to be for low-risk, healthy women, for sure.
I completely agree with that. So for people that are kind of new to either home birth or specifically midwives, can you tell us what the midwifery philosophy of birth is?
Sure. So it would be called the midwife's model of care. You can actually see that if you go to Citizens for Midwifery. They're the ones who years ago came up with that terminology, midwife's model of care. And basically it's individualized care. And for example, we as a home birth midwife, and there are quite a few of us in New Jersey, but my visits with my clients are about an hour. If they wait 5 minutes, it's a long time, and then they spend an hour, asking questions and having their concerns addressed. We do, all the medical care that they need. I don't know any of us who actually have an ultrasound machine in our office, so we can send out for that kind of lab work if needed, or some of us do labs at home, which I do, labs out of my office, and we just kind of do that. We do all the way from, some of us do preconception all the way through, the last weeks after the baby is born. And it's just great. It's great. People feel very, very well cared for when they're working with a home birth midwife. So I think that's part of the difference, is that the doctors are there, they want to help, but they're really under great constriction by their insurance policies and how they're being paid managed care, and they have 6 minutes with people. So there's really a big, big difference in the way that we work with people.
Right. So you're having a lot of time to spend with your client and answer questions and really kind of hold their hand through the process of pregnancy and birth.
People don't want hand-holding, and we're just there as a lifeguard at the birth, too,
Sure.
Some people will come in and they'll want a half-hour visit as opposed to an hour visit. We can do that, too. But most people are really, really happy. The relationship that develops between the midwife and the client is a very, very special, trusting relationship. And so, in a way, we become friends during the time of their pregnancy. And we're guides for them and for their partners as well.
Right.
The offices have toys and stuff for the other kids, and it's a very welcoming environment. And our job is to make them feel safe and to help them to stay low risk. We work with nutrition. Virtually every visit we talk about nutrition. We do offer all of the standard prenatal tests, but it's shared decision making as opposed to the concept of this is what you do this time when you come to the office. We don't do that ever. It's just always a shared decision-making and informed decision-making process when you're working certainly in my practice.
Right, and I would say most midwives would be practicing that way.
I would think so. I mean, it's a little bit different in the hospital. This is certainly a home birth model where you have these types of visits, these long visits, and the getting to know you and being very, very available even during off business hours. Like we're on the phone at all kinds of hours. Sometimes it's hard on us, but we're there for the client. And so, that's that type of, maybe hand-holding that you're talking about, but it makes them feel really safe, and it makes them feel well cared for, and they then feel really fine when they're at home, during their labor and their birth. And by then we've developed such a trusting relationship that if anything is going on during the birth that would maybe require us to go to the hospital, there's never a question as to whether or not this particular intervention is necessary because we've talked about every single thing all along the way. And it makes them, it gives people the sense that they are able to really, really trust what's going on. The people in our practice are really happy.
Yeah, that's definitely, there's a few differences there you pointed out between midwives, especially home birth midwives, and traditional obstetrics.
The intervention rates are very low in home birth.
Yes, I was going to say, because you're supporting a woman with making an educated decision, an informed decision about what is in the best interest for her and her baby, there tends to be less tests, less intervention, less, medicalization of birth.
Yes, so birth is not an accident waiting to happen. Birth is a life cycle event as opposed to a medical event, and we treat it as such until it becomes a medical event. And there are times that it becomes a medical event. And when that happens, we have, that backup that I was talking about. We have resources that we can use if we have to send somebody to an obstetrician or to a perinatologist or for, serial ultrasounds. Like we can do all of these things if need be, but most of the time it's not necessary. So keeping somebody low risk through our care of them over the course of their pregnancy keeps them low risk all the way through the whole process, and much, much lower intervention rates than you see in hospital birth. And this is what the client who's having a home birth obviously doesn't want intervention, or she wouldn't be coming to us. So, we're able to keep it very low. The transfer rate is under 6% in my practice.
Oh, wow. That's very, very
low. Which I think is pretty standard across the home birth community, that the transfer rates are well under 10%. The cesarean section rate in my practice is like 2.7%. It's really low. And so I think that is also, look at the average cesarean section rate in New Jersey in a hospital setting, and it's, upward of 40%, and some hospitals in New Jersey it's over 50%. Now what many people will say is, well, but they do high risk. Yes, that's true, but even though they're doing high risk, 40% of the people walking into the doors are not high risk. So we keep, we're not doing high risk, but even still, the cesarean section rate for home birth midwives being under 3% is, I think, pretty impressive.
That's extremely impressive. The World Health Organization said across the board for low and high-risk women, C-section rates should be around 10 to 12%. So
exactly.
When we see 1 in 3 or higher births are now C-section in the United States, that's really concerning to me, and that is showing that something is off. And I think what we're finding, what midwives have known all along, is the more interventions that are utilized, the more likelihood of having a C-section.
Absolutely. And we trust birth. I mean, that's the other thing, is that the midwifery model of care, there is a trust in birth itself, not just in the woman, not just in the baby, but in birth itself, knowing that it's been going on for, thousands of years, hundreds of thousands, millions, depending upon your belief system as to how long, we've been on the planet. So, it just continues. And yeah, it's good stuff. And the experience matters. The experience matters. And I think it's not that healthy mother, healthy baby isn't number one. Of course it is. But there's more to healthy mother, healthy baby than live mother, live baby. And we obviously want all of it, including the good experience. And I think home birth comes under a lot of criticism when something goes wrong at home and people are like, well, why they should have just had their baby in the hospital. Well, stuff happens in the hospital too. And so there was this recent article in the Hudson Reporter. Actually, there was a guy who contacted me about that and, about outcomes that happen. And all of the outcome, we all want a good outcome. And that's if we could just have good relationships with the medical profession, we would be doing all the low risk and they would be doing all the high risk and everybody would be happy. Because that's really what they want to do anyway. Right, and that's what they're trained to do. That's what they're trained to do. Thank God they're there for that purpose, because that is super important that a high-risk woman be in a hospital with the necessary, medical treatment that she needs to live and survive with her baby. Right. Right. So we've covered this a little bit, but can you share any other differences perhaps between giving birth at home as opposed to giving birth in a hospital? So when you're home, well, first of all, you don't have to go anywhere, which many, many women are really unhappy about the idea of getting into a car in active labor or, heaven forbid, in transitional labor when there's, risking having the baby in the car on the way to the hospital, which happens sometimes. You see that on the news occasionally. So we come to you as opposed to you going somewhere. So that in itself is extremely comforting for people. People with other children don't have to find, child care for their other children. They just need to have a grandmother or somebody in the house who's going to take care of that child should the child need care during the time of the birth. They can do whatever they want at home. We encourage people to eat and drink during labor. We encourage people to rest during labor. We encourage people to walk around and get up and do whatever they need to do in order to have their baby. There's no laying down for the birth. It's just whatever you need to do to have your baby, and we are extremely patient. So, it's 2 hours and we're not checking dilation every hour to see that you're dilating 1 centimeter per hour, and our guidelines are based on what we know birth to be, which is a natural, normal, healthy body event that encompasses all kinds of things, not just the physical, the emotional, the spiritual, and all of it. And so we respect that whole picture as opposed to saying, well, she needs to be induced because she's 40 weeks pregnant in 3 days or something, or 41 weeks pregnant. We don't do that at home. We pay attention to regulations, of course. We're not supposed to do a home birth in New Jersey after 42 weeks. And, so we have natural methods of getting things going toward the end of that period. But we're paying attention to how healthy the baby is. It's not just, well, you're 41 weeks and you need to be induced. We just don't do that. So that's another big difference, is that the induction rates are very, very low also as a result of that, because we wait. We're patient. And it's one-on-one care. You're not getting a different doctor or a different resident or 15 people watching you have your baby. You're not getting, nursing shift changes. It's the midwife and her assistant or her student and you and your doula and your husband or your partner. So it's a whole different environment. It's almost that you can't really compare them.
Yeah.
Because it is so different. I mean, even people that have a good birth in the hospital, which you can do with a great practitioner and great nurses, it's not like you can't have a good birth in the hospital. You can, but it's just so different. The comfort level is completely different. There are no IVs unless we need them. There's no monitoring, constant fetal monitoring. We do, of course, we monitor the baby during the labor. There's no question that we monitor the baby according to standards of care, but we're not strapping anybody into a fetal monitor and doing a constant fetal monitor and an IV drip, and the next thing you know, she's got Pitocin and she can't get up out of the bed, and we don't have any of that stuff. So, and we also don't have a whole team of people, so we're responsible for everything. We're responsible for the mother and the baby. There's no separation ever of mother and baby, which happens routinely in the hospital, even if it's, just for cleaning off of the baby. We don't clean off the baby. We wipe the baby down, and the mother is there with the baby. We do the baby exam on the bed with the mother right there. Yeah. And we go through everything. We talk through the whole exam. We talk to the baby while we're doing a baby exam. The kind of respectful care that people get at home is really, there's nothing like it. There's just nothing like it.
It is like night and day.
It really is.
It's a completely different experience. I had the opportunity and honor to be at my sister's home birth 2 years ago, and it was like the most beautiful thing to witness, and it was really as natural gets. Like, there's nothing getting in the way of my sister birthing her baby and just having this really amazing experience, and then having some eggs after she gave birth and walking around. And
right.
It was
beautiful.
Like,
get up and take a shower. In some places they don't let you take a shower. They don't let you, it's like, you're fine. They're totally fine. It's hard work. There's no question about it.
Right.
It's hard work to have a baby. But you have support that you need, the emotional, physical, spiritual support that you need, as well as the safety net of the clinician who is the midwife.
Right.
To be with you during that time.
And that's the thing, too, is midwives are trained from the perspective for looking for red flags or anything that could create a concern, and you're going to be addressing it, as opposed to a doula who may be at the birth as well, who's there taking care of mom, but is not a medical provider. Exactly.
So the midwives are there. And the thing is, another thing that's different about home and hospital birth, which I find this to be kind of an interesting piece, that when someone is going to a hospital to give birth and they don't want medical intervention, what they are told is come to the hospital as late as possible. So they're staying home as long as they can. They are going to the hospital when the contractions are so close together, and they get there, and now they're already 8 centimeters or something, and there has been no monitoring of this labor the entire time. When you have a home birth, there actually is, in some ways, more monitoring for people who want to have a natural birth in the hospital, who stay home for a really long time. We're there before they would be going to the hospital. So we're monitoring that labor that is not being monitored if they're staying home as long as they possibly can. So there's this interesting little piece that doesn't really get looked at either. And the doctors themselves will say, oh, you want a natural birth? Stay home as long as you can.
Right. It's so funny. Women that go to the hospital earlier tend to have more interventions, and doctors realize that those interventions are going to take away from that natural unmedicated birth.
Right.
Which is why they give that advice. Oh, man, it's so strange.
It is. It's really interesting. So, people that say, well, you don't monitor at a home birth, that's not true.
Mm-hmm.
And we are watching for all those signs all along the way.
Right.
To make sure. We're looking to keep people healthy and low risk during pregnancy, labor, birth, and the postpartum period. We have the postpartum care is another huge difference, I think, that I didn't mention before, which is really important. The postpartum care that we give is really good. When you have a hospital birth, you walk out of that hospital at 24 to 48 hours, and they say, see you in 6 weeks at the office. Mm-hmm. In the meantime, who's taking care of that mom and baby?
Right.
With home birth, you see them 2 or 3 times in the first week, and you see them again later, and then you see them again at 6 weeks. And we're on the phone with them every single day. If we're not at their house on a given day, visiting and making sure and doing checks on the baby and mom, we're on the phone discussing breastfeeding and issues and what's going on and how are they feeling and what's their bleeding and all of that. We do all of that, and so that helps them, again, to stay healthy and low risk all the way through even the postpartum period, so we can pay attention to what's going on. The infant and maternal morbidity and mortality rates in this country are abhorrent in comparison to other countries. We're like on the bottom of the barrel of industrialized nations for care of women and babies. Mm-hmm. It's bad news here. And one of the ways to make it better is to get more midwives, both hospital and home birth midwives.
And educating women that this is an option for them when they're looking for a birth provider in their first trimester of pregnancy or even potentially preconception.
Exactly. You started to ask about my education. The education level, depending upon the type of degree that you get or the type of midwifery certification you get, are different. There are different paths to midwifery. So the certified nurse midwife path would be through the American College of Nurse Midwives, or where you go to school and get a master's in midwifery. You're an RN. Most of the certified nurse midwives are working in hospitals, but we have a beautiful flurry in the New York and New Jersey area of certified nurse midwives doing births at home as well. It's a bit of a different training model than the model that I originally went through, which was the certified professional midwife. My model of learning is an apprenticeship model, and it's out of hospital based. So for me, it was the way to go because I knew I wanted to be a home birth midwife, and I was able to get that training over a 5-year period. I did, of course, academic work as well as clinical work, and attended many, many births over that period of time with a variety of preceptors and teachers that I was going to birth with, which gave me, the skills and knowledge and competence really to be on my own.
That makes a lot of sense, that there would be an apprenticeship where you would be actually observing birth and different births and different practitioners and learning that way as opposed to in a classroom.
Yeah.
That's so funny. And the one thing, too, I wanted to point out, you've hinted at this, but midwives are not only trained on doing prenatal care, delivering babies, and postnatal care, but as you mentioned, you're doing the newborn checkup and also checking the baby as they go along. So there is training for those first few weeks. So typically a baby born at home is not going to see a pediatrician for how long?
Well, that's a good question, and it depends upon the pediatrician that the family has chosen. Most pediatricians want to see the baby within the first week, but that's not necessarily necessary. It depends upon how that baby is doing. We are trained in normal, and we see normal after normal after normal. So when we see things that are not normal, we recognize it very, very quickly. We are not pediatricians any more than we're obstetricians. So when we recognize abnormal, because we see so much normal, we are then able to refer out as necessary. So like I said, some pediatricians want to see the baby within the first few days, and that family will bring the baby within the first few days, and other families are like, well, we had a birth at home. Can't you just come and check on the baby? And we do that, and the babies are fine, and we're qualified and licensed to take care of the baby in those first few weeks after the birth.
Mm-hmm. Right. Sorry, so there is that education as well that midwives have for babies born at home, that if they are normal, healthy, not presenting with any signs that would require medical attention, then there's no need to rush to the pediatrician's office.
Exactly. Yeah.
Yeah, and that's really great, too, because things like even vitamin K shot or the Hep B shot that tend to be given automatically at a hospital birth to a newborn, aren't necessarily going to be happening right away when that child
So in the state of New Jersey, actually, vitamin K is, sorry, let me just turn this off. This person obviously wants to talk to me. Let me turn it off. They called my house first and now here. In the state of New Jersey, vitamin K is an option. You can opt out of it at the hospital, and the same is true at home. In the state of New York, vitamin K is mandatory, but in New Jersey, it's an option. Now, hepatitis B, I do not offer vaccinations. That if they wanted, any kind of vaccinations, they would have to go to their pediatrician for that.
Right.
So.
And also, if they wanted the vitamin K, is it an option to get it orally as opposed to shot?
Yeah. They can do either. And we talk about all of these things prenatally and what their options are and how they want to do it. And that, again, is one of the differences, is that people are making their decisions really well informed. Ad nauseum sometimes. I've had a few people by the end of their pregnancy say, can't you just tell me what to do? It's like, no, we'll have a conversation and you'll make your decision, and it's great because it builds good parents.
Yeah,
it gives people the confidence to be parents when they're making their decisions for their child already.
Mhm. That's right. That's going to be the rest of their lives.
Exactly. And to go back to natural birth at home, maybe I'll be yelled at for this one, but I believe that the way that the birth happens, it affects. We all believe, okay, not just me. This is not me saying some grandiose statement, but it affects the way that people perceive themselves afterward and how they respond. We have PTSD, diagnosed PTSD for women in hospital births and women having experiences that are so traumatic to them that they are having PTSD symptoms afterwards. That's crazy.
Right. The emotional, spiritual component, it can be neglected in a hospital setting.
It can,
what birth is all about.
And I don't want to vilify the hospital because I am so grateful when we need them to be able to access the care that they can provide. I'm grateful for it. So I'm not, condemning their practices when we need it. But most of the time, women don't need it, and nobody knows that. They think, oh, you're so brave to have a home birth. No, frankly, you're brave to have a hospital birth.
It's the other way around.
It's the other way around.
You mentioned 6% transfer. I mean, that's such a small percentage, and then out of that, less than 3% actually led to a surgical birth.
Right.
So it's kind
of not out of that. A total of, in my practice, of under 3% of surgical birth, of cesarean section.
Right, so but from the 6% that were transferred.
So, say half of them.
Yeah.
Right. So,
which is also then an awareness that you could be transferred to a hospital and still avoid a surgical birth.
Absolutely. Most people that get transported don't have a C-section. We transfer for a variety of reasons. Sometimes it's because the labor is going on and we've exhausted all of our resources and the mom is tired and the position of the baby is not doing anything, or the labor has stalled and we can't get it back, and whatever it is, and you go and at that point, well, yes, maybe she needs a little bit of Pitocin. Maybe an epidural and some Pitocin and some rest is going to kick this labor in. Who knows? And it could be an emotional thing. It could be any number of reasons why we end up transferring. We can transfer at any time. Sometimes we transfer postpartum. If we have a retained placenta, we might transfer postpartum. And the transfers, like, people get afraid, oh my gosh, you're calling 911. Most transfers are not a 911 call. Most transfers are, okay, this looks like things are happening in this way. We might be better off listening to the baby more often, where we can get constant monitoring in the hospital. Maybe we should transfer. And then we go on. We go to the hospital. It's in our own car. It's an easy transition, and they go on to have their baby vaginally.
Right.
And we stay with that person. We're not saying, okay, see ya. We go with them and we take care. We continue our care in a different capacity because we're no longer. I don't have privileges in any hospital. So, although there are home birth midwives who also have privileges in hospitals, so they have that continuity of care where they become the provider. But I don't have that.
Right, but you're still with that woman. Yeah.
We still stay with them. Yeah, I still stay with them for sure.
Yeah, still part of the whole birth process.
Yep. Mm-hmm. And then they come back into our care for postpartum.
Right.
So even if they've had a cesarean section, they still come back into our care for postpartum.
Right.
Which is really nice because we're the ones that they're connected with.
Right. Right. You've developed that trust relationship that is comforting, especially if a planned home birth becomes a C-section.
Mm-hmm. Mm-hmm. And then we can process with them.
Right.
We can process that experience so it doesn't turn into a PTSD situation.
Yeah, right. So important. So what's the current percentage of births in the United States that are home births?
It's under 1% for sure. I don't know the actual numbers, but it's well under 1%.
Oh, so small.
Yeah, the Midwives Alliance of North America, which is basically a home for all midwives, is there's a division of research which gathers statistics for home birth and out-of-hospital birth, and there's some great research that has been coming out of that organization, and it's, there were over a period of years they collected data on, I don't know, now the database has upwards of 60,000 births in it. So it's a pretty intense database, and it's certainly not all the home births because not every midwife who's doing home birth is collecting the data. But it's definitely under 1%, and the outcomes are good. I mean, the data that came out in January of this year in the Nursing Journal was just beautiful research on home birth.
Mhm. It showed how safe it is.
Showed how safe it is, yeah.
Yeah.
Yeah, but it is under 1%. We'd like to see it more.
Yeah, and the truth is that it certainly could be. Because you mentioned home birth is a really wonderful option for a low-risk pregnancy, and certainly there is a higher percentage of low-risk pregnancies than 1%.
Right, exactly. Well, and home birth is on the rise for sure. It has gone up dramatically over the years, especially I don't know how many years ago now, but it feels like probably 7 or 8 years ago that The Business of Being Born came out. I'm not really sure what year it came out. Ricky Lake and Abby Epstein put out this documentary called The Business of Being Born. And many, many women, maybe it's 5 or 6 years, I don't know, but many women have changed now, and are sort of seeing things differently because of that. And then Deborah Pascali Bonaro with Orgasmic Birth, and there are many, documentaries and films out now, and you can go to YouTube and, beautiful home water birth or beautiful birth at home, and, you can see all kinds of stuff. So it is on the rise for sure, and so, yeah.
there's more of an awareness of kind of what your options are during your pregnancy. You can choose your birth provider, even if it's, you've been seeing your GYN for 10 years for your well woman care. When you become pregnant, you can switch to someone different.
Absolutely. It's a whole different care.
A whole different care. You can interview different providers to see whose philosophy matches yours. And that you're on the same page, and that your opinions and values are respected.
Well, and to follow your instincts, because when somebody goes to a provider and they're talking, and all of a sudden the hair on the back of your neck is going up because you feel like you're being yesed to death or something, that is a sign that maybe your philosophy actually doesn't match that person. And what is it, what exactly am I going to do if they laugh at your birth plan or whatever? At home, you don't even really need a birth plan. You've spent so much time with your midwife that she knows what you want. She knows your birth plan already. The only thing that we prepare is, maybe what happens if we transfer plan and how does that look. But really, it's a birth vision. How do you see your space? It's just a whole different mindset.
It's just nothing like being at home. It's just so warm and comforting, and it's like sacred.
And it doesn't matter how big or how small your place is. People are always afraid, well, I have a tiny apartment, I can't have a home birth. Many women in a big old mansion having a home birth end up in this tiny little corner in a bathroom. Where we end up. We are mammals, and we like to be safe and enclosed, and so people worry, oh, my space is too small, or the neighbors will hear, or whatever. And it really doesn't have to be like you can be in a very, very small space and have a home birth. And I think that we need to make it more knowledge, like, why can't you walk around the neighborhood in labor? There's nothing wrong with walking around the neighborhood in labor. It shows people that birth is normal. Anything we can do to show people that birth is normal is going to help to change the culture.
That's such a good point. A lot of people don't know what normal is, because what we see on TV and in movies are not normal births.
Right.
Those are not normal.
Anytime people talk about their experiences, you hear all these horror stories. I found it fascinating when I was working with doulas, and as a doula trainer and working with women as their doula, you don't hear from a woman that she had a fabulous birth experience. Well, occasionally you will. Of course, somebody who had an epidural and loved it. I mean, that does happen, of course. But really, people who've had natural birth want to shout it from the rooftops, but then they're afraid, because then they're afraid that they'll be thought of as judgmental about people who didn't have a natural birth. And that's not what the natural birth movement is about. The natural birth movement, if you will, is to try and get things back to good care of women and just mothers and babies together. That first hour after birth is critical. Right. Keep mothers and babies together, not for 5 minutes. For hours and hours and hours, don't ever separate them. So it's, there's a million things that we could talk about that get, the conversation gets a little scattered, because in a short amount of time, it feels like you have to touch on so many things. But it's all important. It's all important. So.
Yeah. Any last thoughts that you'd like to share with the audience?
We need more midwives too.
Yeah.
It's not just about the current birthing moms. It's about needing more midwives, because the more midwives there are, the higher level of care there will be as far as that one-on-one care. Mm-hmm. And that's a shift that has to come. Whenever I have a client who says, oh, maybe I'll be a midwife someday, I'm like, yay! Because we want that. It's not competition. It's adding to we need, the World Health Organization said something like we need 350,000 more midwives.
Wow.
That's a lot of midwives.
That's a lot.
There's a lot of midwives.
for the world.
That would be, I guess, a good last thought. Midwifery care is the way to go.
Right.
And in order to get enough midwifery care for the women out there, we need more midwives.
Right, and that makes so much sense.
Right.
Vicki, I'm so thrilled that you have been, located within my practice in Hoboken for the past 2 years now.
I know, isn't that crazy? 2 years already.
2 years, and it's wonderful because having a location like that really brings more of an awareness that this is an option. If you are pregnant and you're healthy, you can give birth at home, even in such an urban environment like Hoboken.
Exactly.
Mhm.
Yeah,
I love it. I wanted to share, if people want to get more information about you, they can go to your website at seventhmoonhomebirth.com. Thanks so much, Vicki, for coming on the show today.
Thank you, Laura.